Good afternoon. Welcome to the daily briefing here on Friday afternoon, where Chairman Kern and Sam, you have some numbers today that are looking good.
They are. We have so far tested 90,959 St. Clair County residents, which is an increase of 1,175. We are at 7,617 positive test results, which is an increase of 46 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. Today, our daily county positivity rate is 3.9%. And we are at 83,342 negative test results. Unfortunately, we are announcing some additional deaths today. We are announcing a total of 5. However, 3 were from today and 2 were from earlier this week that we just received information on. We had 2 females in their 70s, 1 male in his 80s, 1 female in her 80s with unknown health conditions, and then we had 1 female in her 80s who did have underlying health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 6,883. For state totals, 5,763,128 have been tested, with 297,646 positive test results, which is an increase of 2,206 from yesterday. And for deaths, the state is reporting 8,743, which is an increase of 47 from yesterday. For hospitalization numbers in St. Clair County, currently we have 50 individuals that are admitted due to COVID-related reasons, and 6 of them are on ventilators. For regional hospitalization numbers, we have 97 individuals that are admitted due to COVID-related reasons, and 8 of them are on ventilators. For our congregate living facilities that are in outbreak status, we are only going to announce any facilities that have had changes. Esquilin, the Dammert Center at the Shrine, has 35 cases and 3 deaths, which is an increase of 1 death. 4 Fountains in Belleville has 117 cases and 28 deaths, which is an increase of 1 case. And Integrity Healthcare of Smithton has 58 cases and 6 deaths, which is an increase of 3 deaths for that facility. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. Hospitalizations went down today.
They did, and we had a really, really good day for our county positivity rate, 3.9%. We like to see that.
It was, those numbers are headed in the right direction. We don't like to, of course, see the additional deaths.
No.
That's something that is just a terrible, terrible thing to have to report every day. And hopefully, some days, we like those days when we don't have to report those numbers. So we'll move into the zip code report at this time. We're going to talk about the zip codes where there have been changes in St. Clair County. So we'll start today with 62203. We go up 1 to 220. 62205 goes up 1 to 216. 62206 goes up 4 to 467. 62207 goes up 1 to 257. 62208 goes up 1 to 454. 62220 goes up 3 to 590. 62223 goes up 4 to 457. 62226 goes up 8 today to 786. 62232 goes up 2 to 199. 62243 goes up 1 to 114. 62257 goes up 1 to 37. 62258 goes up 3 to 196. 62260 goes up 1 to 152. And 62269 goes up 8 to 596. As Sam said, we had a bunch of tests today, so 1,175 tests with 46 new positives leads us to a daily St. Clair County positivity rate of 3.9%, which brings our 7-day rolling average to 6.5%. Those are numbers that we like to see, and those are the St. Clair County numbers. The state numbers, the state has us today at a regional positivity of 7.5%, which is the same as we were yesterday. And that number is derived by Bond County, who's helping out today with 2.8%. Clinton comes in at 8.4%. Madison comes in at 5.6%. Monroe at 8.3%. Randolph at 5.3%. St. Clair at 3.7%. And Washington County at 13.5% today. So on day 203, all in all, our numbers in St. Clair County are looking okay.
Yes, they're definitely looking better, and of course, as we said, the 5 deaths are never a good thing, and I see some of the comments being made on here. When we talk about the numbers are good, we're talking about our daily and our rolling and then the regional. We're not talking about the deaths. As the chairman said, no deaths are good, but we are needing to get those positivity rates down, and with the help of Team St. Clair, we're able to do that. When Sam calls over during the day and has to report those numbers, one of the first things we ask is about the deaths. And the days that there's a goose egg there, we all praise that. And unfortunately, with this virus, we have no control over that. The control we have is doing our best to try to get this virus slowed down until they get the vaccine. And so please don't take it that way. When we say the numbers are looking better, that's what we mean. That's all what we need to get the mitigation done. And for those of you who think that the vaccine is going to be here today and this is going to go away tomorrow, that's not going to happen. That's just the reality of this. So we have to get those numbers down. We have to try to stop the spread of it, and we do that by everybody continuing to work together and stay focused on what our mission is here. Chairman, we got a pack of letters here that the mayors and you put together that has been shipped off. Can we just talk about that briefly?
Sure. So, as we talked about yesterday, we had a long conversation with most of the mayors in St. Clair County, and 14 mayors came through and wrote letters to the state. We attached it with an overall cover letter from St. Clair County, which is sent to the Illinois Department of Public Health, sent to the governor's office, asking that they relook at our area. We feel that the mitigations should be put back where they were about a month ago. The weather's getting cold outside. Indoor dining is going to be a must if we're going to keep our businesses going. And the positivity rate that we show, rolling positivity of 6.5 today, the daily at 3.9 certainly warrants a look at what we're asking for and hopefully granting our request. We've got great support from our state leaders, and so we look forward to this message getting to the right place and hopefully falling on friendly ears.
Well, and you mentioned the other counties, and you can see today that they have picked up, you listed all of them here, and that's what it's going to take that we've been saying this last week. If we all push together in the same way in our region, because that's how we're being judged currently, and so we need all of our neighboring communities to come in with these type of numbers that they did today, and that will help get that regional positivity rate down. It stayed the same at 7.5 today. And so we're going to continue to work on that. And again, we appreciate all of Team St. Clair, everything that you shared this briefing, telling your friends, your neighbors, your loved ones. Believe me, you may not think that helps, but we have seen it. We've received calls here at the Emergency Operations Centers from people that say, hey, we were tuned into your briefing because a friend of ours told us about it. We didn't realize that this has been going on. And well, as the chairman and Sam said, 203 days we've been here doing this, and we'll continue to do it as long as the need is there, and that's probably going to be for a while. So we'll be back shortly with Daisy and Cindy to translate this into our Spanish communities, and then we'll be back here every day until the need is not there. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves,
mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock